I'm going to show one case, which is a case I did recently. This was an LAD lesion, which basically looked like a long diffuse lesion, but it was not anything that to the naked eye looked like it was critical. In this patient, the PET scan, you can see here, there's this long lesion in the LAD, but certainly nothing critical. I think most people would have said that's no more than 30 to 40% narrowed, but a long lesion. The PET scan was unequivocal, and so I decided to perform a wire-based, an FFRangio in this patient. So the first step here was to select the target vessel, which was the LAD, input the mean aortic pressure, which at the time was 89 millimeters of mercury. You can select the 3 best angiograms to correspond with the best visualization of the LAD in the lesion. This is where it's important to take good quality angiography without panning, completely opacify the vessels. And you can see here we have selected the lesion in these 3 different views of interest. The vessel lumens are then traced, the LAD, the side branches, and the circumflex to try and build that 3-dimensional resistance flow circuit. The software identifies the degree of luminal narrowing based on the stenosis that you've identified. And then once you accept that, it yields this FFR angiography result. And so in this case, the FFR angio was 0.76, below the 0.8 cutoff, which was significant. And so we went ahead and placed a stent. The stent sizing tool was able to guide the length of stent that would be needed to cover the entirety of not just the lesion, but also where there was a change to normal physiology, so to try and go from normal to normal. And so a long stent was placed, and by doing the post-PCI angiography, we were able to see that the post-PCI FFR was 0.93. So validation of the PCI result with a hemodynamic assessment, which previously you would have to rewire with the FFR wire, recalibrate, give adenosine again to assess that. Now we can do it with our routine post-PCI angiography, and very happy that we have a good angiographic result, but also a good physiological hemodynamic result.